Oh, hi, I didn't see you there. Dr. Nikita Vizniak, and I'm going to be walking you through our fantastic posture poster, educational poster right here. So, like most posters, what does it do? It allows you to stand in front and go ahead and assess somebody's posture. The grids make it easy for you to go ahead and see differences in height and position and all of that. But we go beyond that. There is actually a height measurement ruler in the center of this scale where you can look at it in centimeters or inches. You can measure somebody pre-treatment and post-treatment, how they're actually going to change in height. The next thing that you'll do with this as well is look at basic range of motion. So you could have somebody come in to begin with and you'll have them lean to the side and you'll take a picture with their own phone so they can see pre-treatment and then post-treatment how far things move. But it goes beyond that. If we look up in this area right here in the upper right-hand corner, there is an empty space with a barcode, or sorry, a QR code that links you back to our website. But what you can do with this region is cover it with your own logo and your phone number so that when you're taking those pictures with your client, with your patient, it's a way to soft advertise your clinic and your expertise. So I strongly encourage you to do that. Many clinics use it in that manner. Beyond that, you're always looking for educational opportunities. If I'm still checking range of motion, I can do things like shoulder range of motion here if I want. So you can go ahead, put yourself in the center of this protractor, and then go ahead and measure what internal rotation and external rotation look like. Take pictures pre and post treatment and track those over time. Again, advertising your clinic the whole time that you're doing it. Beyond that, spinal range of motion, same thing, pre-treatment and then post-treatment, how far they can move. If you look at the table here, it has a list of all of the ranges of motion of the body are right here. So it gives you degrees for lumbar, for shoulder, for knee. So you have those as reference ranges. Beyond that, there are multiple other educational opportunities around the poster that facilitate better outcomes for your clients and patients. Some of these include the psychology of chronic injury. A lot of people define themselves by their condition. How many of us have this client that comes in, oh, I can't do that because I have bad knees. Oh, I can't do this because I have scoliosis. This relates directly to that. Pain is threatening information. They get stuck in a lack of visualization of future wellness. So they are in disuse and depression and fear of future movement. Our job is to break that cycle, and you can have that conversation with this graphic right here. Beyond that, we show the healing stages of muscles, ligaments, bones. It doesn't matter. With cellular activity, inflammation, proliferation, and remodeling are here. So you can discuss that with your client and patient, where they are in the overall process and how you can facilitate and support that process in their own body. We then go into the 6 best doctors, which you know what they are. They're going to be healthy eating, social time, outdoor activities, exercise, good sleep, and try and find a little bit of sunshine. Another great way to get solid foundational advice out to your patients and clients. Beyond that, we see pieces of the pain puzzle. Remember, pain is multifactorial. It's not just the injury they have to their tissue. It can also be what they read on Google, how they're manifesting it in their mind, what their friend says, their happiness with their job, and many, many other things. And that includes rating their pain right here on a numeric pain scale with FACES pain scale. How many of us have a client or patient who comes in and says, oh, my pain is a 12 out of 10 today? And you're like, okay, if it's a 12 out of 10, that means that you need to be in the hospital. You're off the charts. And they're like, well, maybe it's not. Maybe it's like a 5 or a 6. What did you do right there? You automatically lowered their pain perception and reference range, and you've resulted in a positive income just by showing them positive outcome, just by showing them the overall change in this poster, okay, in their actual pain perception. Beyond that, we also have great information here on showing how activity is medicine. Almost every condition is improved with a little bit of physical activity, unless you get into super high levels of activity where you can see increases in musculoskeletal strain, osteoporosis with female athletic triads and things like that. But for the overall, for the vast majority of the population, exercise is going to be a benefit for the vast majority of cases. Diabetes, heart disease, high blood pressure, you're not just there rubbing someone's back or cracking their back or just giving them exercise, you're making lifestyle changes for them. Beyond that, this is one of my favorites actually. It's the graph that shows the curvature going up all the way through, where most people think it's going to be a nice smooth journey. And what does healing actually look like? It looks like a stock market graph. It's up and down, back and forth, and you have to be there with your clients at those times and say, hey, the overall trend is improvement, but you're going to have some up days and down days. We're here to celebrate the small victories. If you read any of the 20 plus books I've written, you will see I'm always talking about celebrating those small victories. Beyond that, there is the high quality treatments for musculoskeletal pain, evidence-based with PMID references. The best things you can do to make someone better. I have this picture up in my office as a giant poster actually just by itself. And you have those points to remind yourself during your treatment and help remind your patient of the goals and what you're trying to accomplish. Number one is motivational person-centered interview, ruling out red flags of serious pathology that requires emergency intervention. Then you're going to get into assessing biopsychosocial fears and beliefs. Sleep hygiene has to be there. Activity and mobility has to be checked as well. Strength. You're also going to be looking for outcome markers and activities of daily living that help the person get better. Going into imaging, not 100% diagnostic. So many people think imaging will tell you exactly what's wrong. The correlation between your injuries and what you actually present with can be very different. And in fact, there's research that says if you read a radiology report, your symptoms will automatically be worse. And our job is to counsel patients on this and realize that a lot of the changes they see are normal age-related changes. Beyond that, we go into nutrition, assessment. Nutrition we know is foundational for overall health. We have a whole class on pain and nutrition, graded activity exposure, and then all of our manual therapies supporting this entire evidence-based process. Beyond that, we go into 12 scientific ways to improve happiness. You see the person standing with their arms up because they are happy just like you should be. And those are things that you want to follow. I'll always reiterate with your patients and clients as well. Then we go into the benefits of exercise. And the last couple of things we talk about, walking. We have a graph right there from the American Medical Association that shows the number of steps that you want to take in a day, shooting for that roughly 8,000 steps minimum sweet spot to get your maximum benefit. And even the variations on posture as well down here. So this posture chart is here for you. The things that you can control are things like your physique, your habits, your social network, and your gratitude. I just want to say thank you so much for watching this. And hopefully you'll get one of these posters and help giving better results for your patients in the future. Thank you very much for your time. You can find me at proHealthsys.com, hythera.com, and we look forward to seeing you in one of our books or at a seminar in the future. Thank you very much.